Hi, our names are Katie,
Alice, and Caitlin.
The disease we are presenting is the Zika virus, or also known as the Zika fever. It was first discovered in April 1947 by Alexander John Hadot and a group of other scientists. Alexander John Hadot was a certified scientist who uncovered this deadly virus when a rhesus macaque monkey acquired the disease in Hadot's lab in the Zika forest of Uganda, which is what the virus was named after.
The Zika virus is caused by a virus from the Flavivirus genus, which is from the Spondwini group, which was discovered in 1948. The disease was originally transmitted through infected mosquito bites, specifically those of the Aedes mosquitoes. The main vector is the Aedes aegypti mosquito, but other Aedes species can also have the capability to spread the infectious disease. These infected insects can spread the virus to other people and animals through their bites, which are active throughout the day and night.
The virus can also be spread from mother to child. A pregnant woman diagnosed with Zika fever can pass the virus to her fetus during pregnancy, causing the fetus to have multiple birth defects. Another way for transmission of the virus is through sexual contact, although this isn't common. On top of that, blood transfusion proved to be another situation where the spread of Zika is active. During the French Polynesian outbreak in 2013, which is also the largest outbreak of Zika ever recorded, 20,000 victims caught the virus within the island, with 2.8% of blood donors for the incident test positive for Zika.
Animals and human victims have the capability to obtain Zika. The virus first spread from parts of Africa, specifically in Uganda, and slowly made its way to the Americas, where it is still prominent today. The virus is shown to be generally transmitted throughout parts of North America, Africa, and Asia, with countries that have high Zika warnings such as Mexico, Brazil, Venezuela, Philippines, Vietnam, Argentina, Paraguay, and etc.
Zika affects both genders, but reports in Brazil and El Salvador have shown higher effects of the disease within women. Although the virus can affect individuals of all ages, including a fetus within a pregnant woman, the virus is more contributed within people ages 20 to 49. Women ages 49 to 79 years with suspected cases are most likely to test positive for the Zika fever than most men in the same age category. For a doctor to determine whether a patient is diagnosed with the illness, he or she will try to find a Zika virus RNA within the patient. RNA NAT or RNA nucleic acid testing would be performed on the serum, and the testing would also be conducted on urine samples collected less than 14 days after symptom onset. A positive RNA NAT result on any sample confirms the Zika virus infection, and no additional testing will be indicated.
Zika symptoms are mild and usually last for several days to a week. Typical symptoms of virus are fevers, rashes, headaches, joint pains, muscle pains, and if the victim has conjunctivitis or red eyes. Because of this, many people with the Zika virus don't know that they have infected by it, as they don't get sick enough to visit a hospital and get tested. Rarely is there death accompanying the disease.
The Zika virus, though, remains in the blood for about a week, so doctors can give blood tests to determine whether or not the victim is infected. When a woman affected with the Zika virus is pregnant, the fetus is also affected by the disease and can be born with extreme birth defects, like microcephaly, for example. What we know about Zika is that there is no vaccine that exists to prevent it.
The only way that helps people to elude the virus is by avoiding mosquito bites, especially during vast traveling throughout parts of North America, Africa, and Asia. When staying in countries where there are high alerts of Zika, use an outdoor insect spray made to kill mosquitoes in areas where they rest. Mosquitoes typically rest in dark, humid areas, like under patio furniture. There is no specific medicine or vaccine for the Zika virus. However, victims could do the following steps to make themselves better. Treat the symptoms by getting plenty of rest, drinking fluids to prevent dehydration, and taking medicines such as acetaminophen or Tylenol to reduce fever and pain. Do not take aspirin and other nonsteroidal anti-inflammatory drugs or NSAIDs until dengue can be ruled out to reduce the risk of bleeding. If you are taking medicine for another medical condition, talk to your healthcare provider before taking additional medication.
If you are caring for a person with Zika, take steps to protect yourself from exposure to the person's blood and body fluids, such as urine, stool, or vomit. If you are pregnant, you can care for someone with Zika if you follow these steps. Do not touch blood or body fluids or surfaces with these fluids on them with exposed skin. Wash hands in soap with water immediately after providing care. Remove and wash clothes and clean surfaces if they get blood or body fluids on them. Lastly, clean the sick person's environment daily using household cleaners according to label instructions.